here familiar with diabetes? Okay, most of you. Awesome. Did you know that diabetes is the leading cause of blindness in the world? That may come as a surprise to most of you. When you think about diabetes, most people think about having to avoid certain foods or checking your blood sugar on a daily basis. And although these responsibilities do come with the diagnosis, not many people realize the significant impact that diabetes has on their vision. Today, I'm going to share some insight on the long-term effects that diabetes can have on your eyes so you can help yourself and those around you in your journey to maintaining healthy vision. There are three primary topics we're going to discuss today. The first is a brief introduction to diabetes. The second is diabetic retinopathy. And third are treatment options and prevention methods that you can try. So first, let's take a look into what diabetes actually does to your body. According to the CDC, diabetes is a chronic condition that affects the way your body processes food for energy by over or under producing insulin. Most of the food we eat is broken down into sugar, also known as glucose. Once glucose enters our bloodstream, our bodies produce insulin to help process it as energy or store it for later use. Because diabetes prevents us from producing the correct amount of insulin, most sugars we consume are left behind in the bloodstream. This new influx of sugar causes blood vessels to shrink, ultimately reducing the amount of oxygen being transported throughout the body. As you can see in this figure here, this is a slight image of what actually happens, and you'll notice all the glucose that is stuck behind. According to the National Center for Biotechnology, diabetes affects over 285 million people worldwide. That's 285 million people. So people that you know on a regular basis probably struggle with this disease. Of the 285 million people, 1/3 of them are diagnosed with diabetic retinopathy. According to the American Ophthalmic Association, diabetic retinopathy is the leading cause of vision loss in adults ranging from 20 to 74 years of age, and is caused by damage caused by diabetes on the small blood vessels located in the retina. There are two main types of diabetic retinopathy that we're going to discuss today. The first is NPDR. Non-proliferative diabetic retinopathy is the early stage of the disease. Most patients who experience this or develop this condition may not experience any changes in their vision. It's very mild, and it's really hard to detect on your own. Nonetheless, during this time, blood vessels located in the back of the eye start to bleed and it starts to weaken, and this is known as macular edema or swelling in the macula. As this fluid builds, vision becomes distorted and starts to turn into proliferative diabetic retinopathy, which is more of the advanced to moderate stage of the disease. Due to the increase in sugar in the bloodstream, the eye becomes deprived of oxygen. As a result, new fragile blood vessels form in an effort to provide the eye with oxygen. However, these blood vessels begin leaking fluid quite rapidly due to their weak structure. As you can see in this image here, this is what a normal retina looks like. And over here, you see the red spots. Those are bleeding on the veins. And this over here is where the new blood vessels have grown. Most patients with proliferative diabetic retinopathy start to see a significant decline in their vision, and it starts to be going downhill really fast. Although this may sound ominous, there are many ways to prevent and treat diabetic retinopathy. Some of these treatment options include injections, laser treatments, surgery, most of which are performed by a retinal specialist. According to the CDC, African American descent typically experiences the most with diabetic retinopathy, but most ethnicities are within range about 10%, so there's really not a huge difference there. There aren't any studies that really say if you're at risk based off of your ethnicity. Prevention strategies are create a lifestyle that will help keep your diabetes under control. Work with your doctor to create a good health plan, educate yourself, exercise, eat right, things that maintain a stable blood sugar. Now that you know more about the adverse effect of diabetes can have on your vision, I want to remind you of a few factors that are important to know. Uncontrolled diabetes can cause many serious health conditions that aren't just limited to diabetic retinopathy. Also, diabetes, if not properly regulated, can lead to blindness. Proper regulation of blood sugar is imperative to maintaining healthy vision. So, if that being said, if you have diabetes or you know someone who is struggling with diabetes, encourage them to take control of their condition by developing a plan of action with their doctor and working alongside their local retina specialist to make sure that they are healthy and that this does not affect them in the future. Thank you.